Hello, dear students. Welcome back to your channel, Hello Pharmacology. From today onwards, let us take one important MCQs that can be asked in your NEET PG entrance examination under pharmacology. As well as this MCQ will also help you in terms of answering some of the MCQs that will be asked as a part of your formative assessment or during internal assessment or during final examination during the course of MBBS. So today let us take one MCQ. So coming to the today's MCQ. So today's MCQ is about the malignant hyperthermia. So let us see which is the drug of choice for malignant hyperthermia. We have a 4 options. You need to select the one right option. So we have diazepam, diclofenac, dantrolene and digludac. So let us see. So which of this option will be the drug of choice in the case of malignant hyperthermia. So by this time, hope you would have got the right answer. So first, we'll rule out the options so that it will be very easy in arriving at the correct answer. So as you can see in the option, they almost look similar and you may confused with the option and you may take the wrong answer. So initially you need to rule out. The diazepam is a benzodiazepine, which is a sedative hypnotic. The next, diclofenac is a non-steroidal anti-inflammatory drugs. Basically, they help in anti-inflammatory activity. So digludac is the long-acting insulin analog that is being used for the treatment of diabetes. Many times, most of the students will confuse for diclofenac since it reduces the inflammation. They think that it can be a drug of choice for malignant hyperthermia. But diclofenac is not the drug of choice for malignant hyperthermia. For the drug of choice for malignant hyperthermia is the dantrolene sodium. Please remember the drug of choice for malignant hyperthermia is dantrolene sodium. So it can be asked in the other way also. So dantrolene sodium is a drug of choice in which condition? So your answer should be it is malignant hyperthermia. So with this MCQ, you have learned already 2 MCQs. One is drug of choice for malignant hyperthermia is dantrolene, and dantrolene is a drug of choice in the treatment of malignant hyperthermia. So which are the drugs which can cause malignant hyperthermia? So one, succinylcholine, which is a depolarizing muscle relaxant, as well as the other volatile anesthetic agents like halothane, isoflurane, desflurane, enflurane, sevoflurane. So these are the agents which can cause malignant hyperthermia. So in all this drugs which are inducing malignant hyperthermia, drug of choice will be the dantrolene sodium. So what will be the clinical features of malignant hyperthermia? So please remember, initial clinical feature will be the patient will be having tachycardia. There will be increase in the expiratory carbon dioxide tidal volume, as well as there will be muscle rigidity. So these are the 3 very important initial signs for malignant hyperthermia. Later on, the patient might develop increase in the body temperature. There can be increased breakdown of the muscle fibers, rhabdomyolysis, and also there can be muscle pain. So these are the clinical features you should remember with respect to the malignant hyperthermia. So now let's see how this dantrolene will going to help in the treatment of malignant hyperthermia with the help of the diagram. So as you can see in the diagram, so this is the skeletal muscle. So whenever succinylcholine, which is a depolarizing muscle relaxant, is administered, this succinylcholine will going to bind to the nicotinic acetylcholine receptor which is present on the skeletal muscle. Once it binds to the nicotinic acetylcholine receptors, there will be depolarization. Thereby, there will be moving of sodium inside into the skeletal muscle. So once the succinylcholine attaches to the nicotinic receptors, there will be depolarization and sodium will be entering inside the skeletal muscle, and there will be activation of the sarcoplasmic reticulum. So in the sarcoplasmic reticulum, as you can see, there is a storage of calcium. So through the ryanodine receptors, especially in case of the person who are having abnormal or mutated ryanodine receptor. Please remember, if the patient is having any mutated ryanodine receptor, in such individuals, succinylcholine can stimulate the sarcoplasmic reticulum, and they are going to increase the release of calcium from the sarcoplasmic reticulum, which will further lead to increased muscle contraction, which is responsible for causing malignant hyperthermia. So it is mainly due to the mutation in the ryanodine receptor. So as you can see that this mutated ryanodine receptors now will lead to increased release of calcium from the sarcoplasmic reticulum. This increased released calcium through the mutated ryanodine receptor will going to cause contraction of the skeletal muscle fibers. So this is responsible for the increase in the body temperature or the tachycardia, all the features of malignant hyperthermia. So what will be the drug of choice? Drug of choice for malignant hyperthermia is dantrolene sodium. So dantrolene sodium will going to inhibit the ryanodine receptors. Thereby, it prevents the release of the calcium from the sarcoplasmic reticulum. Thereby, there won't be any calcium concentration. Thereby, reduced calcium will lead to decreased muscle contraction. So basically, dantrolene will going to inhibit the ryanodine receptors. So please remember, in case of, just to summarize, in case of succinylcholine induced malignant hyperthermia, the drug of choice will be dantrolene sodium. Drug of choice will be the dantrolene sodium. On the other way, which is the condition where you can use dantrolene as a drug of choice in case of malignant hyperthermia. So dantrolene is given through intravenous route. Along with that, you need to take care of the other things like airway as well as body cooling has to be done. So this was about the class with respect to MCQ related to the malignant hyperthermia and dantrolene. So please remember, dantrolene sodium is a drug of choice in case of malignant hyperthermia. So if you find this video useful, please do subscribe to my channel, I Love Pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. And tomorrow we will come back with the one more important and interesting MCQ that can be asked under pharmacology. Thank you.